Susan, thank you very much for that wonderful introduction. Um, Hello, everybody. Good afternoon. Hope everyone is well. As Susan said, we're going to be discussing alternative therapies for managing osteoarthritis. In all my years of practice, I feel that probably one of the, next to dermatological cases, one of the most difficult and heartbreaking cases to see are your middle-aged geriatric dogs suffering from severe osteoarthritis, to the point where not only are they in pain, but their quality of life has diminished so greatly that it's impacting not only their lives but the lives of their pet parents. So after a few years of practice, I really wanted to find different ways to be able to help these patients with osteoarthritis, and not only relieve their pain, but just give them comfort and a better quality of life. So this presentation is basically is going to sum up some, not all, of the alternative methods for managing osteoarthritis. I'm finding, and I'm sure a lot of you also are finding, that our pet parents are less interested in pharmaceuticals and are more interested in alternative methods for treating this disease in particular. So I hope this helps all of you. So we'll get started. So the goals of osteoarthritis management in companion animals are aimed at improving quality of life by controlling pain and restoring mobility to the greatest extent possible. Now, we can do this, as I said before, with pharmaceuticals. And again, as I said earlier, we are starting to come across more clients interested in more natural means of treating osteoarthritis. One of the tenets I learned at the Chi Institute is Western medicine is great, and it fixes things very quickly, but the long-term side effects are what we often manage as these pets get older. In Eastern medicine, it takes a little bit longer for the treatments to start taking effect, but we don't see those long-term deleterious side effects from pharmaceuticals. So some traditional modalities for accomplishing these goals include dietary manipulation. We've all seen those overweight, elderly dogs waddling into our offices, clearly just not being able to move around like they used to. Physical therapy, underwater treadmills is a pretty popular modality around where I am. There's surgical and pharmaceutical agents, so non-steroidal anti-inflammatory drugs, corticosteroids, and disease-modifying osteoarthritic drugs, as well as nutraceuticals. So this presentation is going to give a brief overview of some of the alternative modalities that can be used for your primary or adjunctive osteoarthritis management. These alternative therapies that I'll be discussing aren't meant to be standalone, and it doesn't mean that they can't be used with Western medicine, such as NSAIDs and things of that sort. I fancy myself more of a integrated practitioner, so I often combine Eastern and Western medicine and find myself having the best outcomes. So just keep in mind when we're going through this, this isn't to say that you should throw out pharmaceuticals and traditional Western practices. These are just more tools to add to your toolbox. So nutrition. Again, I started saying earlier about those overweight pets. So obesity increases the load on joints, in turn increasing the development of osteoarthritis, the speed of disease progression, and overall patient discomfort. There have been studies out there that we know that white fat is not inert. It actually um, releases hormones that affect cartilage and actually damage cartilage. So it's very important to not only get rid of that load on the joints, but just to lower or decrease the amount of white fat in the patient. So evaluating the patient's diet is an important first step in managing osteoarthritis. So according to a Banfield study, 52% of dogs and 41% of cats with osteoarthritis cared for in 2018, Banfield practices were obese. Results of a lifelong study of 48 Labrador retrievers showed that restricted feeding versus ad libitum, just filling the bowl and throwing it into the kitchen before you go to work, delayed or prevented the development of radiographic signs of arthritis. So again, it's really super important to talk to clients first about nutrition. And if you have an overweight dog with osteoarthritis, it's important to let them know that we have to get those pounds off. If you have an athletic dog with osteoarthritis, obviously we're not so worried about them losing weight, but it is also important to remember that we don't want to restrict their activity either. A favorite saying of mine is motion is lotion. So we want to keep them moving. We want to keep those muscles strong, to keep those joints held in place. And again, to alleviate some of this discomfort associated with osteoarthritis. So a little bit more on nutrition. There's a number of therapeutic diets that are available to aid in weight control and osteoarthritis management. I'm sure each and every one of us can name a few. These diets are often lower in calories than typical diets and contain high levels of omega-3 fatty acids, which help support joint health and mobility by reducing inflammation, as well as having glucosamine and chondroitin in there to help slow cartilage deterioration. Now, I know all of us have clients that are not keen on commercial diets, and I have on many occasions referred clients to veterinary nutritionists. I've also have guided them. There are a lot of websites, good websites out there that will actually help with with the creation of a weight loss diet that the owners can cook at home. Again, people are steering away from pharmaceuticals. People are steering away from commercial diets. A veterinary nutritionist is an ideal person to talk to about developing a weight control diet that'll also help with joints and helping rebuild cartilage. And again, a lot of these websites are ran by veterinary nutritionists that the owners can just go online and few keystrokes and help with a little help from the online resources, also develop a nice diet that they can develop, that they can make at home for their pet. So acupuncture, this is my area of expertise and what I utilize most for treating osteoarthritis in my geriatric and my athletic patients. So acupuncture is a form of traditional Chinese medicine that is performed by introducing thin, specialized needles into acupoints. These needles are all individually packaged. They're sterile. We don't worry about causing infection. We don't have to scrub or alcohol prep the acupuncture sites. These sterile needles are going into the patient. um, into the myofascial region. So we're not going terribly deep, but we are piercing or going through the skin. The use of acupuncture for treating osteoarthritis has become a lot more common in general practice in recent years, and it's often requested by clients as an alternative to pharmaceuticals. I see this on again on a daily basis. Clients are wanting to put down the bottle and trying something different. And I've had a lot of success with it over the years. Chi University, that I graduated from, has really grown in size, and we're finding more and more veterinarians are interested in just learning the basics and the fundamentals of acupuncture to kind of add another tool to their repertoire. So acupuncture isn't just dry needling. That's a common misconception. And there are various acupuncture techniques that we use, that I use on a daily basis. And here they are. So we have acupuncture, which is the introduction of sterile fluid into an acupoint as an alternative to setting dry needles. So I find myself doing this with cats quite often. Cats are not the most ideal candidates for sitting there with dry needles for the 15 to 20 minutes that's required. Doing the acupuncture, not painful. I use B12 because it activates the point a little bit quicker, and actually activates the point for a longer period of time based on several studies that I've read over the years. So acupuncture, especially now during COVID, I tend to have my clients wait in the car. I'll have their dog or their cat or their rabbit or whatever I'm treating that day brought in, and I just use acupuncture, and that turns a 20-25 minute appointment into a 5-10 minute appointment. That way the pet isn't away from the owner for too long. We're decreasing contact time and exposure time also. So acupuncture, probably one of my favorite techniques, especially during these unusual times. There's moxibustion. There is smokeless and flameless moxibustion that can be ordered and purchased online. And basically what we're doing is it incorporates a burning of moxa to apply heat safely to the acupoint. So obviously we're indoors. Obviously we're dealing with patients that have, a lot of fur, a lot of hair. So we want to use the smokeless and the flameless moxa. I've done it on myself. It's very soothing. It's very comfortable. I've done it on multiple patients. They actually more lean into it because it feels good. That warmth on those sore joints and those sore acupoints really, the use of moxa really helps them a lot. Electroacupuncture is another technique that I use quite commonly. This combines the mechanical and electrical effects, and it's commonly used to relieve pain that's associated with osteoarthritis. I tend to use electroacupuncture when the osteoarthritis has advanced to the point where we're starting to develop CP deficits, or in cases obviously of degenerative myelopathy, we'll often use electroacupuncture. Again, very safe. The unit is quiet. I have used the unit on myself, so I know that it's not painful. And again, patients will sit pretty quietly and comfortably during electroacupuncture sessions. And then there's always laser acupuncture, which is using a low intensity laser to stimulate the acupoints. So again, works on the same principles. We're able to use these acupuncture points with all these different modalities. And I've used all the modalities discussed, and I've had a lot of success. And you'd be surprised at how happy the clients are, how quickly the patients respond. Typically with acupuncture, we don't expect a immediate resolution of pain, but I usually tell clients to give me anywhere from 4 to 6 sessions where we're meeting once a week to let the acupuncture work, and I rotate points, and will even increase frequency of acupuncture depending on the patient's response. So herbal formulations are also key. I include herbal formulations with almost all of my acupuncture clients. The combination of the Chinese herbs and the acupuncture, I have found, actually increases duration and effectiveness of acupuncture. So there are several Chinese herbal formulations that contain boswellia and turmeric that have been proven in studies to both safe and effective for reducing pain and inflammation associated with osteoarthritis. As I said before, I feel that Chinese herbal formulations are best used in combination with acupuncture to increase the effectiveness of the treatment. And again, these Chinese herbal formulations are very, very safe to use. I will use them in combination with non-steroidal anti-inflammatories. I'll use it in combination with gabapentin. Oftentimes we're fine just using the herbs alone, but if the herbs and the acupuncture aren't getting us really 100% where we need to be, that's where I'll introduce as needed non-steroidals or as needed gabapentin, just to get them through that 1 or 2 rough days in a row that they might have. So another interesting field to study are stem cells. This modality is actually becoming more common in small animal medicine, as well as particularly for improving mobility and the quality of life in dogs with osteoarthritis. Commercially available autologous adipose-derived mesenchymal stem cells have been used by veterinarians actually since 2003 to treat joint disease as well as tendon and ligament injuries in horses. And I've actually, when I was practicing just out of vet school, there's a lot of off-the-track racehorses that we had used stem cells to deal with their osteoarthritis, with their joint disease, and we saw amazing outcomes. And in a 2007 study, dogs with hip osteoarthritis, treated with stem cells showed a significant improvement in mobility and their pain scores. What's interesting to note too now is there is also becoming available commercially available monoclonal antibodies used basically to treat the pain associated with osteoarthritis. So we're seeing stem cells being used, and we're now seeing monoclonal antibodies being used to help with osteoarthritis. So cannabinoids, I know this is a hot topic for debate, and depending on what state you live in, the laws vary and are different. Here in New Jersey, we're still not able to prescribe cannabinoids, but I can direct people to websites or manufacturers that I trust. So I will often do that. So, so research on the use of cannabinoids in veterinary medicine and the whole endocannabinoid excuse me, system as a whole is actually flourishing. Um, Cannabinoids are being studied for their ability to treat pain as well as inflammation in our osteoarthritis patients. And in a study published in April, CBD was shown to introduce broad anti-inflammatory effects in vivo and a greatly reduced pro-inflammatory tumor necrosis factor alpha in vitro. Again, there are a lot of very safe, very good formulations out there. These products are super effective. And one of the things that I always inform my owners of is their first question is they're worried about the psychotropic effects. So I always let my pet parents know that, we're not worried about that. We're not worried about the psychotropic effects. We're not worried about our dogs, stumbling around, not knowing where they are. The only effect I've ever seen is I've just seen them very tired, and I find that it's usually only after the first couple of doses that they're tired, and I often wonder if it's just because they finally have some sort of relief from pain where they can actually relax and get a comfortable sleep going. So again, you have to look at your local state laws as far as what you're allowed to do regarding CBD products, but it's a great modality, and I'm hoping that it's able to be more used more widespread as time goes on. And obviously with further research, there's new research coming out daily, this could become a really viable, common treatment option for all animals. So pulse electromagnetic field treatment is a type of therapy. It's another form of non-invasive, non-thermal, has been widely studied and actually utilized for nearly a century. So the pulse electromagnetic field therapy has been approved for use by the FDA in both human and veterinary medicine. There have been studies that have showed a great reduction in inflammation and pain. And there's been a few human studies that have showed that actually accelerated bone healing after fractures also. So this is great technology. It's been around for a long time, researched and tested and tried and true. So devices like the Assisi loop, as I was saying before, have been shown to reduce pain and inflammation associated with osteoarthritis in clinical settings. So the Assisi loop is a pulse electromagnetic field device. It consists of a single loop antenna and a battery powered pulse generator, and it's used to treat an area of soft tissue on the patient. Research studies focused on the mechanism of action have demonstrated that targeted pulse electromagnetic field induces downstream production of nitric oxide, and one of the few known gaseous signaling molecules. Nitric oxide is a potent vasodilator and can influence cells of the immune system and the nervous system. So targeted pulse electromagnetic field treatment has been shown to result in production of low concentrations of nitric oxide, which are associated with diminished inflammation and enhancement of vasodilation. I've actually used the CC loop in practice. I loaned my CC loop to a very close friend of mine whose dog was suffering from osteoarthritis, actually in his shoulders. And after 2 weeks of use, and no other drugs, so no Western pharmaceuticals, no Eastern herbs, no acupuncture being done, we actually saw an increased range in motion, diminishment of pain, and he was just a lot more active and a lot happier after its use. So the prevalence of osteoarthritis combined with a shift in client perceptions and the desire to treat with alternative modalities pose a very unique challenge to us. It is now possible to safely and effectively improve the quality of life in the patients when surgery and pharmaceuticals are not options. The modalities selected should be tailored to the patient's specific needs and the owner's ability to remain consistent in their role as a caregiver. As I said before, I've used pharmaceuticals and nutraceuticals in combination. I've used it in combination with acupuncture. It's all about treating the patient, obviously, the best way possible for them. But we all know that compliance is a killer. If we can't have our clients compliant, if they can't bring their pet to the office twice a week for acupuncture, if they can't afford pharmaceuticals, if they refuse all forms of Western medicine, it's really important for us to be able to offer them all modalities and all possibilities to relieve their pet's pain from osteoarthritis. So that is the end of the PowerPoint. I do have some studies that I used. All right.